Despite calls for mandatory mental health treatment, the Ford government is backing away from comments the Premier made last week, suggesting the possibility is being looked at.
We continue to connect more people at every stage of life with the right care at the right time.
Health Minister Sylvia Jones quick to point out the province's existing funding for mental health and addiction, while announcing another program and partnership with CAMH. It comes as the province's big city mayors grapple with the idea of forced mental health treatment in response to the issue of increased homelessness and encampments.
By prioritizing timely interventions, we can reduce harm, promote recovery, and foster a healthier, more resilient community where everyone has the opportunity to rebuild their lives with dignity. The same old approach isn't working.
Brampton Mayor Patrick Brown is asking the province to implement a pilot program, echoing the BC government's plan to expand involuntary care for people with brain injuries, mental illness, and severe addiction. Premier Ford suggested last week it was an option in Ontario.
We're looking at it. I know my minister, Michael Tabolo, is a big fan of it, but we have to look into it pretty deep. So I'm always open to any idea.
At the CAMH announcement, Dr. Aristotle Vaneskis suggested it's not as easy making treatment mandatory for all on the street in an effort to find them help.
It's really hard to answer a question about everyone out on the street because there's so many different roads, so to speak, to getting there. And it's possible that a small subset would meet that test if we evaluated them in hospital, but there's many people who probably wouldn't.
Despite Premier Ford's suggestion that his Minister of Mental Health and Addictions is a big fan, Tabolo took a step back from those comments 1 week later.
When it comes to compassionate interventions, I think that's something that really needs to be studied and looked at. Personally, my opinion is that until we have the system built that allows people to get treatment when and where they are, we really need to continue focusing on that.
Minister Jones emphasizing that some of those treatment options will be available as part of the new Heart Hub program. Organizations that want to be involved have until the end of next week to let the province know. Mark McAllister, City News.